Hello and welcome to our podcast. Thank you so much for joining us again. I am your host Kanika Malhotra, and today we are going to deep dive into an important topic which is often overlooked: patient education. The doctors are overburdened and the patients are overwhelmed. And somewhere, when we talk about the recovery outcomes, that is the most important aspect that gets affected. Today, joining me is Mr. Vivek Srivastav, who is founder and former CEO Healthcare at Home. With 21 years of extensive experience, he has seen healthcare industry inside out, from acute care to chronic care to out of hospital care. He has seen it all. Welcome, sir. Welcome to our podcast.
Thank you, Kanika.
So, sir, to start with our podcast, my first question to you would be when it comes to the challenges of the healthcare system, because we know that doctors don't have time and patients have so many things to handle. Where do you see exactly the challenges or the participation gap when we talk about the patients and the healthcare providers?
See, I think the big challenges of Indian healthcare in terms of this, patient education and understanding is one, like you mentioned, doctors don't have time, right? I remember a time in the early days of HCH where I went to an oncologist and we were chit-chatting and he said, Ki, Vivek, see this list of patients. He had 80 patients to see in a day. And, if you think of it, if he spends 5 minutes per patient, it will be a huge number without break, which means they will never have the time to be able to do it because just the overwhelming doctor-patient ratio in the country, especially in super specialization. Second is, language barriers. So, I've had doctors who in South, moved from North, cannot speak those languages, so people will not understand. You'll have cultural context different, socioeconomic challenges, which means, they may not be able to address what a lower middle class person would feel education wise and so on. Also literacy. I mean, you may not be able to explain people exactly what is required just because literacy nahi hai. So those are few things which are a constraint in patient education in the country.
So, sir, you mentioned we have a diverse cultural backgrounds. We have an Indian healthcare ecosystem is complex. So, why do you feel that empowering the patients with the right authentic kind of information is even necessary in today's times?
Of course it is, right? And the reason for that is if they're not educated or aware, then there are variety of things which can potentially impact the outcomes for the patient. For example, we ran a lot of programs where we wanted to educate patients so that they don't drop off from therapy, which is a big thing in chronic disease, right? So managing chronic diseases, education is very important because drug is of certain value. What the patient needs to do beyond the drug is very important. I mean, a patient may take an insulin for diabetes and eat chole bhature. You can't do anything with that kind of patient. So education is very important. And many times what will happen is because of the other education not being available, they'll think, oh, the drug is not working, right? So, or the doctor has not been able to treat me, while education was a constraint. So education is a constraint. If it's patients are not educated, chronic disease management will be an issue. Preventive health, right? There is a lot which we can do in preventive health segment. If you do the right things, you will not actually get the chronic disease, right, in the first place, or other diseases, right? Just hygiene, for example, will not lead you to get into acute situations. If you manage your chronic diseases, you'll not get into acute situations, and these become critical from a patient point of view and from a payer and society point of view, because we will lose a lot of quali or dailies depending upon the situation, and which is not good for the patient, the family, the payer or the society.
So, sir, now that we have established the fact that it is extremely important, but doctors don't have the time, they don't have the appropriate tools, they have limited resources. So how do you think this participation gap that gets fueled often with these challenges can be tackled?
See, you're right that the doctors need a lot of tools to be able to educate the patients, because they will not have time. So there has to be some standardized material available for them in multiple languages with different contextual things, so that they're able to give it to patients. And for example, we ran a lot of programs where there were educators who are available on phone or physically present, so that the doctor could refer that please go and talk. In one of the cases, these were placed in gastroenterologists clinics, so that the doctor could prescribe and say go talk to this person, and that person will educate. Now of course, as technology and telecom and AI is becoming more and more prevalent, you could actually do this using the technologies and so on. But yeah, that's standardized materials, contextual, language, and very easy dissemination methods available to the doctors, and support, right, in terms of people around them who can take that load out of them, could help doctors educating the patients more.
Right. So in your experience, have you seen doctors embracing technology, the innovation and the technology that is coming up in your experience? Have you seen some barriers or some resistance when we talk about technology?
No, the doctors are increasingly becoming more savvy themselves, right? So whether it's on social media, they want to, right? They want to be on social media, they want to educate people, because they also know that they have only 24 hours in the day. So if they need to manage more and more patients, they need to use technologies to be able to do it, and hence they are open. Of course, the newer generations have been tech savvy from day one. The older generations have not been as tech savvy, but they have learned, right, and they're now trying to use it in variety of forms, from basic scan codes available in their clinics, to many of them now I see using the HIMS or clinic management softwares with ease. So I think and social media, of course, they are becoming more and more open, and if there is support given to them, they will definitely use that more and more.
So when we talk about the traditional methods as compared to the AI that is growing at exponential speed in today's world, what do you see the pros and cons in terms of the traditional methods and the AI that is growing in terms of accessibility, scalability and credibility?
See, I think the traditional methods are, which means the doctor explaining or someone physically explaining, right, or giving a brochure, etc. Typically, if you are physically present, you can be very contextual. You can be very, you can, manage the communication basis, the understanding of the individual language, culture, etc., which is very, very important. You can give that human touch, right? You can keep, you can manage confidentiality, etc. In these kind of circumstances. Of course, the cons is that people, this cannot scale, right? Because if you are doing one-on-one, then there's only limited time. Plus, the person who's trying to explain, right? That person's may have constraints on language and culture himself, or there may be issues of he or she not being updated, right? For the the latest things. So those are some of the, and of course it's not scalable and it's costly, right? With AI, now it can be scaled very fast. It can become contextual. You can have language things as well, and hence the cost of dissemination is very low. The cons with AI is that the trust is still poor, right? So you don't know whether the AI is actually referring from a credible source, or it read it from let's say a Reddit post or a Quora post, which would be posted by someone, and you don't know whether it's trustworthy or not. And many times, I've seen that when you ask for the, reference from where you picked it up, it's unable to give that. So trust is a big challenge currently, and hence that needs to be sorted. And then the data privacy, right? Whether people would want to tell this, because you don't know where all this data flows out, right? There's no control, and in many cases where there's confidentiality or other things, people may be very wary of trusting technology, and hence there has to be a mechanism to handle this.
We spoke about the gaps, we spoke about the participation, we spoke about technology. Going forward in the next 5-10 years, based on your extensive experience, where do you see patient education foraying? And if you have to give one piece of advice to health tech innovators like Humeta, what would that be?
See, I think patient education would continue to become more and more digital and AI driven, right? Today, the way people have started using, at least the people who are very well educated and exposed to these technologies, they've started using it left, right and center, right? And hence every health tech innovators like yourself or Humeta would basically have to run as fast as and scale as fast as possible. As we have mentioned, right, contextualization and language, etc., is very important. So localization of the content becomes very important. Third and most important is how do you ensure trustworthiness, right? If the products have to be developed, they have to be developed in such a way that they're actually backed by credible research. They are validated in whatever ways you can, so that it's very differentiated from someone searching just on ChatGPT or Perplexity or whatever, right? With offers like Airtel giving Perplexity free, right? This is going to expand significantly. But what you don't want is people diagnosing themselves with wrong things, and hence it has to be a tool for education and not diagnosis, and hence a very close coordination with the with the doctors, HCPS, etc., so that they transfer their trust to the patient, saying, look, you use this will give you the right thing. Don't use anything random. Many times now you see doctors cabins, there's written Google Doctor, some comment on Google Doctors are written, or so I think that's very key, that you have to be a partner to the HCPs and not an adversary, because then your trust level will go down, because the doctors will not recommend, right? So that's also very critical. You have to make sure that you actually enable the system, whether it's the HCPs, whether it's the hospitals, whether it's credible provider of healthcare, that they are able to disseminate it, saying this is great, this is trustworthy, and ways to figure out how do you handle the data privacy and confidentiality in that process.
Thank you so much, sir. That was a very insightful and a powerful thought process that you've given us through. I'm sure this will add some value. If you have any questions for us, please leave them in the comment section below, and we'll see you in the next podcast. Thank you so much for watching.